Record the computer. Hello, and welcome to session 2 of Stress in the Healthcare Workplace. I am your host, Audrey Johnson with RX View. I am a pharmacist by profession, a senior operations consultant for pharmacy practice and professional trainer in the pharmacy and healthcare space. And you are, sir?
Absolutely. My name is Travis Steinman. I will be the co-host this evening. I am the host of the Talks with Trav podcast, and I am a personal and professional strategist that specializes in stress management and work-life harmony.
Okay, great. So this is session 2. We are actually doing these sessions on stress in the healthcare workplace in recognition of Mental Health Awareness Month. So we chose stress in the healthcare workplace. As we know, healthcare workers absolutely experience a lot of stress on a daily basis. Healthcare is a highly regulated profession. Patients come to us because they need to get well. They trust their loved ones with us, their lives with us, and our performances matter. And in order for us to render that safe practice of performance and support, our stress needs to be controlled and managed. That we can actually identify that stress in the workplace has risen, and it's a lot of factors. So in session 1, we kind of just did a groundbreaking on stress in the healthcare workplace, and actually it's across the gamut. It's all industries have stress in their workplaces. But some of the things we spoke to, and we said that this week, we just kind of unpack it and compartmentalize and kind of methodically talk about intrinsic and extrinsic factors. However, on last week, we just kind of threw it all on the board and said everything from scheduling to staff to workload to training, home factors, health issues, not feeling supported by leadership, not having the tools and the resources to do your job, disorganization in the workplace, organizational behaviors, a lot of factors kind of threw out on the board that we spoke to that do create stress and make it a very stressful work environment. I mean, we spend a lot of time at work on a daily basis, either an 8-hour shift or 7 to 12-hour, multiple days, and you spend more time at your place of work than you do in your pleasantry of your home or events, etc. Right? And healthcare is, I would have to almost think, well, I don't want to say I see. It's hard to be a healthy health practitioner because you are so stretched on time, especially if you work Monday through Friday and you're short staffed or you're that committed and over obligated or in leadership. It's hard for you to break away and go to the doctor yourself or take the stress down. So I know that stress management is one of your spaces of expertise. So I'd like to hear from you on how do we take all of these little things and organize them so that we can actually manage them. Some of it is controllable and some of it is uncontrollable. The organization and the business unit, they can't control that, but leaders can make a difference and workers can be more vocal about what their needs are. But I'd like to hear from you.
Sure. And I think you're exactly right. It is very hard when you're the person that's providing the care for people in those stressful situations and environments, long shifts and things of that nature, to actually take care of yourself. And I would say step one, as to your point, is getting clarity on what stress you can actually do something about and what stress you need to learn how to just cope with and live with. Because you're going to have, if you are a provider in the ER, you're going to have those acute stress situations where a code comes in or something like that. There's no workaround for it. If you work in an ER, you're going to experience that. So you have to learn how to navigate it as it comes. Now, the thing with the stress in the healthcare workplace as opposed to any other place is if you're so stressed out and you make a mistake in a bank, somebody's account might be off or a report might be wrong, or you might send an email to the wrong person. But if you're so stressed out and you make a mistake in the healthcare setting, you might administer too much or not enough or the wrong medication. or you might put in the wrong diagnosis code. I can share
Absolutely.
a quick example with you. When
Yes.
I was in the healthcare field, I was on the business side of it. So I did patient accounts. I worked my way up to management in there. And when I was a supervisor, I was registering in the ER. I was on hour like 15, I believe. And like I worked my normal shift, and then like an hour before I got off, people started calling out and no one was willing to work. So I had to work and stay late. So it was already, 7, 8 o'clock at night. I'd been there all day. Um, and somebody got admitted to the hospital, and the reason for admission was not in our dictionary. In none of the ICD-10 codes were appropriate. So there was a specific code for general sickness, and I put that in, or at least I thought I did, because the next day my director came to me and said, Travis, I need to talk to you about this patient that you had processed the admission on last night. Um, Apparently, I put in the code for a particular plague. So the CDC, the Florida Department of Health, and everything, like they all got these notifications that somebody had been admitted to the hospital I worked at for I can't remember. It might have been the bubonic plague. I don't remember, but it was like a particular plague that was a big deal, and that happened because I pressed 7 instead of 8 on the keyboard because I had been working so long. My ability to pay attention to the details, even something that small, kind of dwindled the longer I worked. So yeah, I thankfully it was just me typing the wrong button and not somebody getting the wrong medication. Um, so that's one example of how the impact stress can have on you. But when you are getting these stresses compounded upon you, you have to figure out which stresses you can do something about and which stresses you need to learn to cope with, and what works best for you. Because in my experience, if you, like, let's say there's the same situation occurs for both of us, it's going to impact us differently. So there is no one size fits all for stress management. It is independent upon the individual and the situation itself. So just a couple of pieces there. Clarity, step one: get clear on what the stress is, where the stress is coming from, and what you can or can't do about it.
Right. So when you talk about work stress in the workplace, especially the healthcare workplace, because being a highly regulated profession, there are a lot of guidelines, metrics, rules, and regulations that we have to abide by. There's patient care safety, there's metrics, there's a lot that goes into that. So focus is important. Focus is very important. Proper rest is very important. And so this week we discussed that we would touch on some of the intrinsic and extrinsic external factors that play a part in stress, and speak to what you can do, what you can't do, and how to manage it, all of there in between. Because stress in the workplace has definitely increased significantly and creating a lot of health challenges in all workspaces. And the mental health, this is Mental Health Awareness Month. So we decided to speak to stress in the workplace for healthcare professionals, but this still applies across all industries. It applies all across all industries. And next week, we'll speak to the impact of stress in the workplace on session 3, and actually put some figures to it. But for the sake of today, and last week we spoke to, a lot of the generalities of workload, scheduling, breaks, not having supplies, whatever those, your co-workers, organizational behavior, leadership, absence thereof, a lot of those factors. And you spoke to the intrinsic factors that you're already dealing with. And I shared about, having to drop the kids off at school, or before you even get to work, or you had a flat tire on the way or got a ticket. So you're already kind of on amped up. Then when you get in and there's a lot of chaos and disorganization, it's hard to kind of bring that scale down and bring that focus on board. But to your point, you can't make the errors in healthcare that you may be able to rectify or correct in other industries. So there is a heavier load in regards to stress in those factors. I'm going to share a screen, and then this is a list of 16 stressors from an article that I located that I thought would be very applicable to tonight's conversation. So let me see if I can get to the share screen. Here we go. Okay, awesome. So some of the intrinsic, extrinsic factors that were listed on long work hours that we spoke to, having a great work-life balance is necessary. Job insecurity, that's a high stressor. That is a high stressor to contend with on a daily, especially when you're working under conditions of so much uncertainty and absence of communication. Like workers feeling insecure about their jobs. There's been a lot of job closures, a lot of downsizes and labor reduction. The economy is showing that we're at threat of losing so many millions of jobs, if they don't increase the debt ceiling. So that's a lot of stress that weighs on you, especially in healthcare. I know that some business units announced that they're closing 2,000 stores, are going to reduce by 3,000 staff members. And you don't know if that gavel's going to fall on you. So you're carrying that. Low salaries, excessive and tiring commutes, the travels to work. I know that a number of contract workers at this one particular unit, they drive an hour plus. Some of them are driving an hour, 15 minutes, and an hour in and out. And so you're talking 2 hours on top of your 8.5 hours of schedule. So your daily is 10, 12 hours. And if you have to run an errand in between there, you're at a 12-hour day. So work commute, increase in demands, unrealistic deadlines that you were speaking to earlier, too many meetings, email overload, incompetent and uncaring managers and supervisors made the list, which we spoke to that as well. Meaningless targets, lack of social support, insufficient control over job-related decisions, that top-down management style that comes in. So that also is a proponent and makes a number of people feel uncomfortable or disengaged. And when disengagement comes on board, now you've got an imbalance in work contribution. And so now we may have Travis doing 80% of the work and Artie's doing 20% because, they're not going to listen to me anyway. So what difference does it make? And I'm disengaged. So all of these factors, this is a big area. So this article actually came from positivepsychology.com and the workplace stress and its causes, and is written by Dr. Jeremy Sutton. Would you like to speak to any of those or comment?
Yeah, absolutely. So looking through the list, I'm thinking back to my time as a team member and a member of leadership, and I can pinpoint a time multiple times for each and every single one of these. And in fact, if you look at the first one, longer working hours impacting work-life balance. I cannot tell you the amount of stress that one is under after working all day just to come home to have your significant other or your kids tell you that they don't feel like you're there, that you don't spend enough time with them. Or in my case, I was a salaried manager and I had to bring my work home every day. I had a laptop I had to work on every day. My wife was like, even when you're here, you're not here because you're at work. So like that's a huge thing. And that's one of the reasons I started specializing in those two combined, because I know they go hand in hand. And the list is spot on, and I believe that it comes from like some of these are from the American Psychological Association, a study they did, and something. Yeah, okay. So one of the things that I found out when I first started really looking at the statistics of stress is about 80% of all primary care visits are due to stress-related or stress adverse events. And 43% of all deaths in the United States of America are directly related to stress. Almost half of the reason people die is because of too much stress. And your workload is a significant factor in that. Like all of these things on this list, your workplace is a huge factor in that, because as you said earlier today, or earlier in this call, we spend more time with our work family than we do with our real family. in a lot of cases, especially in the healthcare setting. It was very common for me to see people in there, oh yeah, I'm working a 16-hour shift today. Oh yeah, I'm working a double, and when you deal with all, what is there, 16? I don't know how many there are. There's several. Yeah, 16
There's
possible
16 on
causes of
this
stress.
particular list. Mhm.
Yeah, on that list right there. When you're dealing with all of those at any given time and any given day and any combination of multiple, it messes with your psyche. So to talk about the intrinsic side of it, when you feel like you cannot escape on a subconscious level, your brain starts to disassociate. So you physically are at work, but mentally you're in la la land. You're somewhere else. You're in survival mode. You're not making the correct decisions. You're not capable of making appropriate decisions, let alone critical ones that could be life impacting. So each one of these presents their own challenge on the stress, and ultimately, stress is simply a hormonal response. Initially, it starts out to say, hey, you need to make a change. Here's the warning flag that you need to do something different. But when you're weighed down and bogged down and quite frankly, like overwhelmed with all of these different stressors just at work, it's not possible. And God forbid you have a few stressors at home, because then you're really in trouble. And that's when, the compound effect of the negative aspects kick in and makes you, go into these dissociative states, gives you anxiety, depression, all of that. And when you're looking at a good example I can share with you is the lack of social support, right? When I was a manager, people would come to me and I would talk to them. You could tell if something was off and they want to talk about something personal more often than not. But I would ask them, hey, do I need to take my badge off? Meaning, like, do you need to talk to a person, not your boss? Right. So what would happen there is they would be like, oh, wait, I can actually come and talk to you about things outside of, hey, how do I do this thing for work? So that opened up a new door for a relationship. And I know not a lot of places have that. But yeah, to your point, that list is a great example of the
One of
multitude
the
of
things on there
stressors.
was the constant change in technology. And we were talking about internal, external factors, right? And I focus my functionality and my performances are more in the external.
Hmm.
I don't really deal with the intrinsic person per se. I do social engineering, but primarily I do engineering of pharmacy practices and organization of the
Right.
workplace, right? And I work from the exterior inward to identify what tools, resources, workflow design needs more improvement on their efficiency. And then that in itself will typically contract some of the challenges of stressors for the team. And then I kind of get into the policy, procedures, training, competencies thereof, and then start the social engineering.
Right.
Okay. But one of the ones on the list was changes in technology. And that is going to be even the more increase because now we have digital health. And digital health is doing two things: is creating stress on number one, the number of different platforms that are there. So there's training, there's competencies, as well as the replacement of labor and job insecurity. So it feeds into job insecurity because there are going to be some replacements of jobs and have been
Hmm.
replacements of job with technology. And
Yep.
that's automation devices on compounding, on dispensing units. We have virtual dispensing medication cabinetries that have been placed and piloted. It was a Canada pilot about, I don't know, like 5-7 years ago. But now those devices have, and I know in the South Florida area, are already
Hmm.
in the emergency room. Instead of them having to go to the drugstore to get a couple of doses, they can actually get their prescription filled from the dispensing
Oh,
ATM
wow.
medication dispensing unit in the emergency room before they go home.
Wow.
Yes, so that has replaced. Now it has a limited number of medications, but it pretty much
Sure.
covers. So we look at formularies and dispensing activity, and covers a predominantly the gamut of what's being dispensed on the 80-20 rule.
Gotcha. Yeah.
No controlled substances.
Yeah.
However, it's just important. It's just impressive to see that list. And next week, when we really talk to the impact and the health stressors, you mentioned some of the statistics. 30% of skeletal muscle issues are stress related. Stiff neck, stiff back, headaches, recurring headaches have been associated with workplace stress. And I know that one of the articles I think we saw and one of the research of recent was saying that, when people go to the doctor, they just give them a prescription for pills or 2 weeks off of work. It's like, well, I can't take 2 weeks of work off. I don't have 2 weeks of PTO time or sick time to take off. And so that in itself creates stress on top of the stress that you're always contending with.
Exactly. And I'm glad you brought up specifically the change in technology,
Yes.
because like it doesn't matter if you're changing technology, a policy, a procedure, a schedule, the uniform. Team members, people, absolutely, humans don't like change.
Respond
Change
to change
is
differently.
scary.
Yes.
Yes, it is outside of our comfort zone. It is not what we know. We have to learn something new, creating the sense of inadequacies, creating the limiting beliefs, the self-sabotage, the lacking in confidence. Just something as simple as hey, I know we used to put some of the papers here and the others papers here. We're actually going to put some of them here and the rest over here now.
Oh, they come
People,
unglued.
they're just like, what are you doing?
Like, where is it? It's like, it's right there. It's right there.
Yeah, it's just shift your eyes to the right. That's all you have to do. But, we as humans have such a hard time with making those changes because our subconscious mind is like, hey, no, this is what we know is safe. Anything we change, it goes back to our ancestral brain, our primal brains of, we can't go venture into the unknown because we could die. And it still spills out in those situations where you get some new technology or a new process and you're like, oh, now I'm just completely incapable of doing my job.
So let's start to kind of wrap and tie this, bundle this back in. So in summary, for today's session about intrinsic and external, I spoke to the external factors: workplace organization, supplies, tools, resources, re-engineering workflow, looking at scheduling. Those are extrinsic factors, not external factors. Looking at staffing models, those things the employer absolutely can imply. And they can call in a consultant, such as myself or someone to come in and assist with those re-engineering and that engineering activity. Speak to some of the tools and the support that you render professionals, as far as like, do you give them a roadmap, or do you have a workbook? You encourage meditation? What do you do?
Yeah, sure. So
stressors?
absolutely. As I mentioned earlier, it's very situational. There is no one size fits all. There's general practices. Meditation's a great one. If I can go into a place of business and get leadership to agree to having their team do like a daily quick meditation, or even a few times throughout the day doing some quick breathing practices, like that's huge, because they're more often than not, they're so rigid and no, we need them to be available at all times for their job. But what they don't realize is if you give someone 5 minutes every hour to just gather themselves and step away from their job, they're going to come back and be significantly more productive. So even though technically you're looking at it like, oh, over an 8-hour shift, I'm losing 40 minutes of paid time for these employees, you're getting 20 to 30% more productivity out of them with less work, in less time, because of that.
I probably wouldn't. I mean, I would probably push against a 5 minute as well, just being in an administrative leadership role. However, I am very much an advocate of timely breaks. And last week I shared of a business unit that I know integrated very timely breaks every 2 hours.
Sure.
There's a 2 hour, then your 15-minute. Most business units, most people miss their free 15-minute breaks. They get their 30-minute lunch, and it may not be on time, or it may have to be a working lunch, which that should not be. But every 2 hours is 2 hours, they get the 15-minute, and they integrated IT into it, that their system is actually timed out for that scheduled time, so they can't work.
Yeah.
Per se, so they can go take a 15-minute decompress. They return 2 hours later, they go in a 30-minute break. When they return 2 hours later, their last 15 minutes, and then 2 hours is time to go home. That's a very methodical, and that's very textbook for them to have integrated IT into it to actually even have that take place.
No, that's very progressive workplace care.
Oh, yeah. And then tranquility rooms are a new wave as well, that businesses
Sure.
are setting up serenity rooms or tranquility rooms that don't have television noise and low lighting to
Yeah.
allow that escape time to decompress. But I've
Yeah.
seen break rooms that are in disarray. They're, they're cluttered, they're nasty. They don't have anywhere to retreat to go eat. Now they're trying to go out to the parking lot to eat in the car.
Hmm.
So there's opportunity for business units, but I think it's going to be very revealing next week when we speak to the financial tab us in health
Yeah,
issues
absolutely.
associated with work stress in the
Yeah.
healthcare workplace.
Yeah. If I could just add one more thing,
Absolutely.
when it comes to like the intrinsic side of things,
Mm,
my biggest goal is bridging the gap in communication between leadership and team members,
yes,
especially specifically around that stress and that mental well-being. Because if that's why I'd mentioned earlier, like I asked, do I need to take my badge off? Do you need a human or do you need Travis, the boss? Because if you need me to be your manager, I have obligations per my job description to hold you accountable to doing your job. But if you need a human, then we can talk about what's going on. And helping leadership create that environment and that communication, that chain of communication with their team is so important. It's invaluable to the actual overall well-being of the team.
absolutely. I
So,
agree. Agreed on that. Now, there's a lot of leadership training courses, and I know a lot of business units actually send their senior leadership in for training, but then
mhm,
the application and the utilization of those tools doesn't typically get transferred
correct,
over.
correct.
They're not really transferred over. So there's an opportunity to develop charters, department charters, be
Yeah,
available, have a liaison within the team, a committee, a council meeting, a council committee within the team, a safe space conversations that can be integrated. Those are some of those operational tools. And I like, you speaking to the trainings that you afford in regards to meditation, giving them a roadmap and a workbook to work through
yeah.
and getting better rest and actually scheduling themselves. They can do a better job personally at
Hmm.
scheduling yourself. Like you really should maybe adjust and be awake and up an hour before you hit the door versus walking out the door 15 minutes and you're in a straddle. Lay out everything the night before. So I guess those are
Right.
tips and tools for intrinsic controls
Yeah.
that you render. Is that correct?
Absolutely. Yeah, no, 100%. You have to have the game plan or the roadmap, if you will, to declutter your life in every aspect, be it physical clutter or mental clutter.
Because what
You
you do
know,
in
so
one area of your life feeds over into the next
how
area.
you do anything is how you do everything. That's
Mhm.
right.
Well, this has been great speaking with you this evening. I look forward to finishing up this segment with session 3 next week on the impact and
Absolutely.
financial impact numbers that are associated with stress in the healthcare workplace.
Absolutely. Thanks again.
All right. Thank you. Have a great evening. Goodbye, everyone. Come back next week.